The world has now confirmed over 10 million cases of COVID-19, and the global pandemic rages on. More than 500,000 people have died of COVID-19, according to the World Health Organization. And at this point, the virus seems to be an unstoppable force and perhaps stronger than before, resurfacing in what some have called a second wave in countries like South Korea, China, and other parts of the world that hoped they had flattened the curve. Some countries like the United Kingdom expect the fallout to drag into next year. To break down the situation and also learn about the drugs being developed to fight COVID-19, we connect with Dr. Eric Ding, health economist and a visiting scientist at the Harvard Chan School of Public Health. Hi, Dr. Ding. It's lovely to have you back on the programme.
Happy to be back.
Well, here in South Korea, in countries like South Korea and China, some say that we're now experiencing a second wave of COVID-19 infections. So really, I'm curious, what makes it a second wave rather than just a continuation of the first wave?
Well, that is kind of great, but usually a second wave is after you have crushed the first curve. So for many countries like Israel, South Korea, they fully crushed the first curve, but if there's a resurgence, some people call it second wave. Meanwhile, US, we never even fully crushed the first curve. We were at a high plateau, and now it's going back up. So I would say for the US, it's more of a second peak of first wave. But in any case, the virus is resurging, and we have to be super vigilant again.
Well, what are the risks involved in the second wave, and why are experts saying that it would likely be deadlier than the first?
Well, we're not sure if it will be deadlier. In certain ways, we have more drugs. We know more treatments. We know how to fine-tune the ventilators better and how to treat the blood clots. But in certain ways, I think it's more dangerous because people have more distancing fatigue, lockdown fatigue. They do not want to lock down further. And in the summers, especially in the northern hemisphere, people want to gather. And when you gather, oftentimes you have these super spreading indoor events. So there's a lot more potential now for people to spread from person to person because people do not have the stamina to keep distancing.
Well, people are very reluctant to stay under lockdown, as you just mentioned. And I think the recent remarks by President Trump, they've raised a lot of eyebrows. I mean, I don't think those have really helped. I mean, what kind of response do you think public officials should be giving to this in order to help people actually remain in lockdown and practice, sensible measures in response to this virus?
I think there's a lot of leadership that's lacking in the United States. I think presidents should send messages of, we're not through this, what we have to do is ramp up testing, contact tracing, quarantine, and you should help comply as much as we can with all the public health orders, wear a mask, and it's all about setting for example as well. But right now, Trump is just doing the exact opposite of everything and telling his conservative Republican governors to force them to open businesses, open, without careful measures in place. And that just causes a huge recipe for disaster, especially since they reopened too quickly and too many people are gathering, and hence we have this resurgence.
And he's expressed a lot of skepticism towards testing for COVID-19. I mean, but let's say that the United States slowed down testing, then what do you think would really happen?
Well, testing allows you to find cases early because as opposed to if you're insufficient testing, you won't know if you have it until you're very sick and hospitalized, like in many countries, like in Mexico. But the problem with that is, the later you test, you're exposing yourself to more people early on. And testing, contact tracing, quarantine is the hallmark of how to stop old epidemics, classically like Ebola or the old SARS, which we were able to defeat even without a vaccine. But we're not doing enough early testing, again, contact tracing, and isolation of those early cases. And that is when there's more potential for spread.
Well, in the US, imposing lockdowns or even requiring the wearing of face masks has met a lot of resistance, and it looks like the White House won't be pushing for such measures anyway. But do you think the individual should be trusted to take socially responsible actions, though? I mean, I heard a lot of contact tracing attempts in Europe have failed.
Yeah. Well, contact tracing, it's generally only when the cases are reasonably modest or low. When there's a runaway epidemic, it's too much to trace all at once, especially when you don't have digital technology. Mask wearing does, if you're not going to do distancing and lockdowns, mask wearing, 95% compliance is absolutely critical. We do know it can reduce transmission anywhere around 70% or even more. And if everyone wears it, we can actually reduce the transmission down to containment levels. But the problem is in the US, it's become this hyper-polarized political signaling that if you wear a mask, you're liberal or regarded as a sheep by some conservatives. And that is just really, really bad that the mask wearing has become a partisan issue, even though if everyone wore it, we would not have to shut down the economy.
Well, in the meantime, British scientists have found that dexamethasone can reduce mortality in COVID-19 patients on ventilation. Does this mean that now a significant number of deaths can be prevented?
Yeah, that's very hopeful. And just to be clear, dexamethasone is a cheap, inexpensive steroid drug, but only works if you're either hospitalized on oxygen or ventilators. If you take it any earlier before your shortness of breath requiring oxygen, it does not work. It might actually increase your risk of severe events. But if you do it when you're on ventilators or oxygen, it does reduce mortality by anywhere from 20% to 1/3. And I think that's a huge boon considering that this drug is very inexpensive. So, like I said, if you were to get sick from COVID, it's better to get sick much later when we know how to treat it than to get sick right now. And so I'm hopeful mortality will drop a little bit as a result in the future.
So some good news there, though. Precautions should be taken, as you just mentioned. Well, a few hours ago, we heard that bio company Gilead Sciences is planning to charge more than $3,000 for its antiviral treatments for COVID-19. Do you think that's a fair price for the drug?
I don't think it's fair. First of all, it's charging $3,100 to Americans, but only $2,000 and change for non-US market. And secondly, who paid for the trial? It was approved basically for a 1,000-person US taxpayer NIH-funded trial. And this 1,000-person trial was what made the drug efficacious in the evidence. But now you turn around and then they're charging that amount. That is very unethical. It is highway robbery, price gouging of every form. And consider at the same time, it's not even proven to reduce mortality, just shorten illness. Meanwhile, dexamethasone is actually shown to reduce mortality, and it is just a few pennies, $1 or $2 per dose. So I think remdesivir is definitely overpriced for what it does and how it basically was shown successful based on taxpayer dollars, and now they want to price gouge us.
And if they really push forward with this, astronomical pricing, then do you think it could set a bad example for, future drugs being made? I mean, as the price keeps getting higher and higher.
Yeah, because this pandemic is only going to grow in many ways. WHO, Dr. Tedros says, this will get worse before it gets better. And with that ominous, it will get worse mantra, I really hope pharmaceutical companies don't use this opportunity to price gouge, because price gouging in the middle of a pandemic actually in the end hurts us all and keeps the pandemic going longer. So I think pharma companies should really reevaluate their priorities and their values in life.
Well, in terms of developing vaccines, some studies say that they may only be effective for about 2 to 3 months. And if so, then why would it be the case?
Yeah, so vaccines, that wasn't about vaccine. It was about antibodies that are detectable. They're saying that antibodies are detectable by 2 to 3 months, and then it goes down to almost undetectable levels. But you have to keep in mind, just because once you've been infected, just because your antibodies disappear, doesn't mean you don't have immunity. Your body has something called memory B cells. And these B cells are like the archive that has replicas, that's a recipe for the antibodies. So later on, when you get sick again, it summons the antibodies back up from the library archives. So just because you don't detect it doesn't mean your body doesn't have it. Your body does have a copy, and likely that is how long-term immunity will persist.
Well, for now, it seems that every country seems to be in the dark about when a vaccine would be out. And while some countries are expecting the current level of daily infections and deaths to continue for months to come, I mean, even until next year in the UK's case, is there anything that can be done or any hope of the situation improving?
I think, we can, short of, again, lockdowns, which everyone dreads, with mask wearing, we can conquer it. Many countries have conquered it, especially Asian countries. Also, Czech Republic, very, very strict mask wearing. And then soon it was disappeared and children are back at school. There are ways we can conquer this. And I think we should also ramp up production for masks. But all things are way better than lockdowns.
Then, as you said before, I mean, compliance with these measures is really important. And what can members of the public do to suffer less from a second wave if it comes?
To suffer less, I would say, these kind of, again, besides mask wearing, I cannot emphasize enough mask wearing. Mask wearing is one of potentially the easiest, least expensive, least intrusive things we can do. I think restaurants should avoid indoor seating. Indoor seating, the concept that you could distance within indoor restaurants is almost laughable because it's not practical at all. I think avoiding indoor gatherings is just absolutely critical. And there's other technologies like far UV lamps that are potentially they can be installed in buildings to disinfect. But I think mask wearing is clearly the easiest, fastest solution, as long as we can get over our political biases around it.
I mean, wearing face masks and avoiding indoor seating, they seem like the least that we can do. I mean, they don't require much effort, right? But of course, it's so hard to muster up that will, I suppose, in a lot of people. Well, I'm afraid that's where we'll have to wrap up our interview today. Dr. Eric Ding, a visiting scientist at Harvard Chan School of Public Health, thank you so much for joining the programme.
Okay.
This is also where we wrap up the show today. Thank you for watching.